I was joined from Hattiesburg by my friend, Dr. Rasheeda Hall, owner of Hall Health. Thank you so much for joining us today. This is our college career readiness class. We're in the health science career cluster, and we're recording this for all of our friends in Madison County schools, Madison Central, Rosa Scott, Ridgeland High School, Germantown High School, the Academic Option Center, my good friend and fellow USM alum Mary Slaughter over there at the Madison Career and Technical Center, and our YouTube channel. So thank you for making some time for us today.
Thank you for having me.
All right, so obviously we want to talk about all the things you do as a doctor and all the great careers in medicine
Mm.
because it is a lot more than I think a lot of people realize, and a lot more goes into it than I think a lot of students realize. But just give us a little background. North Forest High School,
Mhm.
went to Southern Miss, then went to UMC, and you now have an MD behind your name as a medical doctor.
Yes, yes. So yeah, I went into Southern Miss not knowing I was going to be a doctor, but not sure what path to take to get there. And so I as like most students, I went through a few majors. Started off with music education. And music education and biological sciences double. And realized that wasn't the greatest idea, so I had to pick one. Then went over to, actually, I dropped both of them. Went over to medical technology or clinical laboratory science,
Right.
and and so that's what my degree was in. Worked a couple of years in the lab and in a cancer clinic, and then went on to med school. Hmm.
Wow.
Yes.
Now, when we talk about becoming a doctor, because I've lost count of the amount of kids that tell me they want to be a doctor
Hmm.
because all they see is the big salary and they see the stuff on TV and they just think you can just snap your fingers, boom, I'm a doctor. So, talk a little bit about the process to become an MD in the state of Mississippi for kids that are interested in being a doctor.
Okay. So the first thing I'll say is, when you get to college, you can major in anything. I think the common misconception is that you have to major in something like biological sciences because that's what most people do. But you can major in anything. And honestly, the more interesting it is, the more you have to talk about during an interview. And so I would say whatever interests you, whatever you can do well with, you major in that. Make sure you're looking at, like, say, the University of Mississippi Medical Center's website to see what the prerequisites are. Some schools don't always have a strong pre-med advisor program. And so you want to make sure that you're in touch with someone that can help you to make sure that you're meeting all the prerequisites to get into medical school. So you have to have a number of sciences and maths, have to do well in those classes. And but also they want well-rounded students. So do something outside the classroom, whether it's intramurals or clubs or organizations, working, tutoring, anything that makes you interesting. They don't want to see, someone that all they do is go to class and that's it. Because as a physician, you have to be able to deal with a lot of different people and personalities. I think that's the thing we don't think about when we're getting into it, right? When we get into it, it's like, I just want to heal people, I want to help people. And then you're like, oh, this is a very peopling job. Down from the people you interact with on staff to the patients that you see in your office. So yeah, so major in anything, check your prerequisites, do things outside the classroom, and then there's the MCAT. They keep changing it, so I don't know what it looks like now, but it is the bane of most people's existence. So you want to start thinking about it early on so you can figure out the best way to prepare. And it's a standardized test. And so you just have to prepare and see what's on it, whether it's, going through different tutoring courses, things like that, and go from there. Now, UMC usually, or in the past, I'm not sure what they have now, but they've had a lot of a lot of different courses throughout the summer for varying ages, all the way from probably elementary on through high school to help get people prepared for medical school.
Yeah, and it really is, and you made some fantastic points there, so I appreciate that. It really is, it can be rewarding, but it is a very lengthy process.
Mhm.
Um, Now, I'm glad you mentioned something too, because it is a very peopling industry.
Hmm.
And I do want to talk about all the different areas of health science. You don't have to just be a doctor or a nurse. I mean,
Hmm.
there are at jobs that didn't exist 10 years ago in health science now that are very needed.
Hmm.
Uh, and I know Southern Miss is really, and Mississippi College are both pushing the physician assistant program. We'll get to that in a second.
Hmm.
But for anybody that wants to be in health science, I think it's very important to realize, because people say they're attracted to the money. But however, what they don't tell you, you got to touch people, you got to smell people, you have to see
See
blood,
body fluids.
you got to see bodily fluids, you got to clean people up, you got to see vomit. You
Mhm.
have to get people that are mad at you. You got to get people that, unfortunately, sometimes you have to watch people pass away. You have to
Mhm.
see the insides of bodies. And if you're not fully prepared for that, this will not be the field for you. I hate to be blunt, but it is
Mhm.
100% true.
Yes, yes. And that's another I failed to mention before, but for a lot of applications, they make sure that you have spent some time shadowing
Yeah.
a doctor or been in a hospital setting to understand that you know what you're getting into. It's one thing to be smart and be able to do all the prereqs and do well on the MCAT and get in, but it's another thing to know exactly what you're getting into. Yeah, so that's a very good point.
Yeah, and my good friend Alan Loving over at UMC, the Volunteer Services Director, he is always looking for people to come and help out. And
Hmm.
he's gotten some of our students over there. They're already shadowing health professionals, getting the hospital experience. That's
Hmm.
going to look great on
Yes,
any application, but it also gives you a real life view of what these health professionals are dealing with. Now,
yes.
I also want to talk about, and I just mentioned it, is a lot of people they hear how long it takes to be a doctor, like, man, I'm not going to be in school that long. There's always going to be a need for nurses, and I always in all these other jobs I say how we need more females. We need more men to get into nursing. Every nurse I talk to says, man, if we just had one more male on this floor, it'd be so much easier. And there's a
Absolutely.
lot of things I didn't think about. They said a lot of times men are stronger. They can move somebody that's heavier. They can reach something that's higher up in an emergency situation. They just bring that balance of personalities.
Mm-hmm.
So we need men to get into nursing. And then if you still don't want to be, a nurse and have those long hours, there's a need for techs. There's a need for therapists, therapist assistants. I had a hospital stay a couple of years ago, and I saw literally every kind of person that you can imagine. I didn't just deal with the doctors and the nurses. I
Hmm.
had a great CNA. I had a nutritionist
Yes.
because I'm a bariatric
Hmm.
coming and talking about what I could eat. I
Hmm.
had somebody drawing my blood. I had somebody coming in and fixing the machine. A pharmacist had to mix my IV bag before it ever got to me. So there are just so many other
So many
areas
things.
that
Hmm.
touch patient care that don't necessarily have to have an MD or an RN behind their name.
Hmm. Yeah, so perfect example, my undergraduate degree as a clinical laboratory scientist, right? So someone that's in the lab dealing with the blood, doing the all the tests and things like that that the doctors and providers use to make the decisions that they make. That knowledge came to me through a flyer that Southern Miss had sent to my home. I was like, well, this looks interesting, and so being in the lab, um, you talk about therapists. One thing when I got to med school, I was like, I did not know that you could get paid to play with kids in the hospital. That is a job. Play therapy is a real job, and now there's even more things, right? Think about all the things that make the hospital go from the administration side to the technical side. As far as making the computers go, making sure that those systems stay up and running. Now we have AI, right? Making sure that things are more efficient. There's anything you can think of, you can apply it to the medical field. There's plenty of things. A nurse's aide, where they're doing the vitals and checking in on the patients. So many things.
Yeah, and I'm glad you mentioned the technical side because medicine is getting more and more automated, more and more computerized. Big shout out to my friend Alan Grissett, who's in charge of IT at UMC, and he's on call 24 hours a day because that server cannot go down.
Cannot.
People's lives are at stake if the server goes down. People don't think about that. The
Mhm.
IT people, it's getting to the point where the IT and engineering folks in the hospital are just as important as the medical professional because so many
Absolutely.
things are automated. You got people's vital records, you got people's medications.
Hmm.
You know, it's people aren't just writing it down. All that is stored electronically. All that has to be up and running in order for people to be able to survive while they're in the hospital.
Absolutely. The machines that we use, people are developing new products to help fix different problems that people are having. And so you have people that develop those products, people that sell those products, people that demonstrate how to use these different things that the say surgeons use in the operating room. It, yeah, the opportunities are endless.
Now, something I always like to talk about when it comes to health science is the need to be able to communicate with anybody. All
Hmm.
these kids moan and groan when they have to be in another language. But when you are working in an emergency situation or you're in any time where somebody's life or health is at stake, you can't always hunt for an interpreter.
Correct.
You know, because my dad's a doctor in Tupelo, and he has said, I've had to learn enough Spanish to where I can communicate with somebody. I don't
Mhm.
have time to hunt for an interpreter when somebody's life's at stake. My
Absolutely.
sisters, who were in dental school, have learned to sign. They can talk to people that are hearing impaired. So for kids that are moaning and groaning about having to take a foreign language in this field, not only is it vital, it can make you extremely marketable to get a
Absolutely.
job anywhere if you can communicate with more people that can walk through the door.
Absolutely. Absolutely. I definitely, when I was at Southern Miss, I took a study abroad and I honed in on my Spanish, and it has really served me um, throughout the entire process. I have a lot of Spanish speaking patients. Even though I'm not quite fluent, I still can communicate well with them. And the respect and trust that you gain from at least trying to understand and communicate with them goes a long way in the relationship.
Yeah, because like we said, if somebody's life's at stake, any time that is wasted, yeah, it can mean life or death for that family or that person. It's just so vital, and I just encourage everybody, no matter what field you go into, learn it. Learn to communicate with anybody. If you can communicate
Absolutely.
with people, you can do a great job in any field. Now,
Mhm.
I'm about to get to their questions, but one thing I think is important to talk about. We talked about the need for men in nursing, and I stand by that. And for all of our young men, really consider getting into nursing. There are more opportunities for men now in the nursing field than there ever has been. But we need more diversity in medicine. And
Yes.
it's not that the people that are in it are bad people. It's not that they're racist or they have evil in their heart, but there's just so many things they don't know.
Hmm.
Well, a friend on this platform, Dr. Misty Freeman in Alabama, wrote a book about unconscious bias when it comes to medicine, when it
Hmm.
comes to the AI and the diagnosing. Somebody like me is not going to understand the health needs of a black woman or an Asian woman or, obviously a different gender, but there are different health risks among different races all over the world.
Hmm.
And if we only have one type of person in the field, things are going to get missed. Things are
Absolutely.
going to slip through the cracks. We've heard too many stories of people that were misdiagnosed. Now, was it on purpose? Absolutely not. But because there wasn't that knowledge and that diversity in the room, it's caused people to be misdiagnosed and have even longer health problems. So obviously the face of medicine has changed drastically, even in the last 30 years. But, I always say, and I know you're from a rural area, and we're in a rural area here. It's not people's fault where they're born. It's not people's fault what they're exposed to.
Hmm.
There were not a lot of black doctors in the 60s, 70s, and 80s in Mississippi, but there's more and more every year, and we need more of these kids to really consider getting into this space because they are needed. So why is the diversity so needed in the medical field?
So representation matters. I think the thing I hear the most, especially from Black women, is that they don't feel heard. They don't, and that's a combination of the system being so broken where there's not enough time to sit down with people for a long period of time. There's communication and cultural barriers where what they're saying isn't isn't what's being heard by the physician or the provider. Or when you're sick, right, you result to what you're most comfortable with, and the language and the diction that you're most comfortable with, right? And so if you're saying something that isn't computing, or you just don't feel like having to explain certain things, then there's a barrier in care, right? So when so stating when a black woman comes to me, like there's automatically a sigh of relief. There's a lot of things that don't have to be said because it's a shared lived experience, right? And so the more people that come into medicine of various backgrounds, not just race, but different backgrounds, different upbringings, right? Different religions. The more diversity, the more people will find someone that relates more to them. Because ultimately, the first part of the healthcare relationship is trust, and finding somebody you can relate to, it's a lot easier for the patient to trust you. I know in the kind of practice I have, direct primary care is membership based, so uh, I don't operate in the normal parameters of traditional medicine where insurance, based where you have to see another patient every 15 minutes or so. I have longer appointment times, so I get more time to get down to the bottom of things instead of just putting band-aids on things because you don't have the time to relate to the patient. But yes, a lot, and what happens is if people see a thing, then they realize they can be a thing. So the more doctors that are diverse, the more people realize, oh, I could, if they can do that, I can do that too. And ultimately we just improve care across the board. Um, the more diverse it is, absolutely, absolutely.
Yeah, and any of our students in some of our other areas that may be Hindu or Muslim, there are a lot of religious things that go into medical care as far as
Mhm,
religious customs. You
mhm,
know, and again, it's not that people are don't mean well, but if they don't have that background in that culture, it is very, very
mhm,
difficult to understand all
mhm.
those religious things when it comes to medical care. So, for any of our students that may be Hindu, Muslim, or Jewish, really need them to get involved in it as well,
Absolutely.
because it's a huge part of our population and our population is changing.
Hmm.
Now I do have some questions from the students,
Okay.
and I actually only have one young man in here with me today. So I've got a room full of very bright, very intelligent black women who
Mhm.
have got some great questions for you.
Okay.
And this first one is, I like this one. This is Deani Johnson. She's in
Mhm.
ninth grade, a member of our band here. And she asked, were there any moments in school that made you doubt your path?
I would say, um, yeah, yeah. I think anybody would experience, but especially with medicine, as early as accelerated chemistry in college, I'm like, oh my goodness, what am I doing? But but I think everybody has their journey, and in medicine, there no matter how bright, gifted, and intelligent you are, there's going to be something about the process that makes you question everything. And so, in those times, you have to remember why you decided that it's what you wanted to do, and remember that everything that you need is already within inside of you. And just trust the fact that if the vision was given to you, if this is what you feel strongly about pursuing, then anything that you need to accomplish that, you will have it. And so so you just have to continue to encourage yourself no matter what you face.
I like this one because this is Michaela Burke. She's in 10th grade, one of our choir members and also a band member, one of our volleyball players as well. And she asked, you mentioned the hands-on training and clinical experience before getting into the field. So what type of hands-on training would I need before I started this career?
So I would say at this stage, volunteering. You mentioned UMC, but also Jackson Free Clinic. They open up their doors for students, both I believe they still do high school students and college students. You may want to do like I did and do a different career on the way to doing that. There's a lot of doctors that start off as CNAs or medical assistants, and
Yep.
then or even scribes, just getting in the middle of the action. And I think another popular one is I forget what they're called, but they work in the ER collecting patient demographic and insurance information. But just any of those little things, whether it's volunteering or paid, just getting in the middle of things and kind of seeing what people are doing to see, is this really what I want to do? And then once you get into medical school, a part of your training is usually the last couple of years, unless you're in an integrated system, the last couple of years are specifically clinical experience where every day you're doing a different, or every month you're doing a different rotation in a specific area of medicine so you get exposed to as much as possible.
Yeah, and we actually have an alum who just finished up in Memphis as to be a doctor of physical therapy. But
Mhm.
before he started physical therapy school, he spent a year as a PT tech at
Mhm.
Capital Ortho in Jackson to learn the field as much as possible. And he got to see what the techs do, what he would be asking the techs to do. Got to learn some of the. He learned a lot of the lingo. Saw how the what goes on in the clinic. So before he ever stepped foot in a PT classroom, he knew exactly what was going on. So that is such a great way to go into it. I like this one. This is Kaylin Bullock. She's in ninth grade, and she asked, "What was your biggest inspiration to become a doctor?"
My biggest inspiration. I think that's a difficult question because according to my mother, decided to be a doctor at the age of 2. At the age of 2, I decided and never wavered from it. I will say that as I got older and shadow different physicians and things like that, it just solidified that I wanted to help people in that way, because I feel like your health is and being healthy is the best way to experience life. You can have money, you can have power, you can have talent, but if you're not in good health, you can't enjoy any of those things.
There you
And
go.
so I just, yeah, I can't pick one particular moment, but I think all the things throughout the years just solidified the fact that, yep, this is exactly what I want to do.
Awesome. Well, I have time for two more. This one is Brianna Carson. She's in 10th grade, member of our band as well. And she asked, "What was the hardest part of medical school?"
Ooh, the hardest part of medical school. Um, Honestly, it might have changed every year. But I would say for medical school, um, for most of us, the content, like the different subjects that you learn, like biochemistry and pathophysiology and all these different things, the content in itself wasn't that difficult. It was the amount that you have to kind of digest and retain thrown at you at one time. A lot of people before me, Warren said, it's like drinking water out of a fire hydrant. It's just coming at you really fast. And so and I think especially for people like me that didn't really have to study throughout high school and college, you're now faced with the fact like, oh, I need more tools. I don't really know how to study. And so it's really a journey in finding yourself and finding out um and adjusting, being able to adjust, finding out, okay, this doesn't work for me like it did before. I need to figure out what works. I need to figure it out quickly. But I would say for me personally, being what I guess people would consider an introvert, kind of doing more consuming the world than letting the world what I think and what I know in medical school, especially I didn't tell y'all this, but I started off as wanting to be a surgeon. And so I did 2 years in a general surgery residency before I saw the light, I say, and realized that it wasn't a good fit for me. And a lot of these very I would say competitive specialties, you have to prove and show what you know. So I've always been content knowing that I know that, right? But for me, I had to kind of get outside of my box and
There
let
you go.
other people know.
There you
Like when
go.
you're not really competitive, you have to like, okay, like it's enough for me to know I know this, but if I'm quiet and I'm not telling them that I know it, then they just may automatically assume, and usually they did automatically assume that I did not know it. And so I had advisors kind of say, you just have to speak up more. You know, you have to be more assertive and maybe even aggressive in, sharing with people what you know. And so I think that for me, that might have been one of the more difficult things is being more open in my communication instead of just absorbing all the information, being able to communicate that I knew it as well.
Absolutely. And I can go on all day. That's one of my biggest soapboxes is about communication. But we don't have time today. I got time for one more. This is Brianna Williams. She's in 10th grade, member of our basketball team here. And she asked, what's the hardest thing about being in health science that people may not realize?
The hardest thing about being in health science. Um, Honestly, I think that may be an individual question. Um,
I
that
can
may
see
be
that.
that may be an individual question. I will say if you want to go beyond and yeah, I don't know. I'm not sure I have an answer for that. I will say definitely developing study skills and
Oh,
and getting in study groups with not just people that you're comfortable with, but I think the um, being in diverse study groups give you different angles to look at the same subject matter or problem and communicating regularly with your professors.
yeah.
Um, I think one of the things I did, I went to class, absorbed it, went back, right? And I became a tutor on campus, but I didn't need tutoring. And so I would have to try to later on I realized, oh, I need letters of reference from some of these professors. I need to develop a relationship. So I would say pick several times throughout the semester going to the different professors and either having a good question or just finding something interesting to talk about so that they know who you are, and obviously if you are having any difficulty, get help early, get help early on in that. But yeah, I can't really say what might be difficult for majority of people.
That is, I agree 100% on that. Now we're almost out of time, and we thank you so much for taking some time for us. But a couple things before we go. First of all, joinhallhealth.com is the website. More information on you, more information on the practice. People can, if they have any questions, they can email you there. Um, but the last thing, and I think this is so important, and I am far from a medical expert,
Mhm.
but however, I think it's important because you mentioned about people's health really can affect so many things that they're able to do in their life. And uh, 2 years, about a year and a half ago, I had a health scare, and I did like a lot of people do. I ignored what was going on. That I'll just rest. I'll take some Tylenol, and I finally went to the doctor. And
Mhm.
if I had not gone to the doctor, I would have died. So it is so important. Never ignore symptoms. Talk
Yes.
to medical professionals. Don't think, well, I may be overreacting. Well, you may not be overreacting. So
Hmm.
just talk about the importance. How important is it as these kids, move through high school, move into college, or wherever they go in their life, to always pay attention to symptoms they may have.
Absolutely. Um, So the first thing you want to do is start to learn about and practice healthy habits, right? Make sure you're staying hydrated, make sure you're doing, a well-balanced diet, and if you have allergies or just things, a lot of things you don't like, at least do a multivitamin. Make sure you're exercising or, being in some activity that keeps you active. But yeah, I think number one thing is pain. Um, we don't hurt for just for no reason. That's the number one thing that your body does to get your attention. And a lot of people will just like, oh, well, I'll just take this or that to make the pain go away. But you're not really addressing what's caused the pain. So you always want to, I'm not going to tell people not to Google. A lot of medical professionals say don't Google. I would say if you Google, right? So when you Google, the number one thing you will see, it will tell you is that you're dying. Yeah. And to be honest, we're all dying at some rate. But the main thing is if you go on Google and you see something, you need to take it to a medical professional and don't just act on it on your own. You need to have somebody to break down the information. But yes, you want to make sure that you're going and getting your checkups. You want to make sure that if you're having some symptoms, especially mental health, right? If you're feeling down and sad and things aren't, making you happy anymore, like that's not normal. You want to make sure that you reach out to your doctor or find one to help you understand what's going on. And there's no shame in medication for that, right? There's chemical imbalances that prevent you from experience the happiness that comes with different hormone release and things like that. So not to get too scientific, but if you're not waking up happy majority of the days, or you're having pains or some other weird thing going on, always go and talk to somebody and try to medical professional and try to relay it to them to the best of your ability. And it's better for you to tell them your symptoms and what you're feeling rather than to just say what you think it is, because then something might get missed, right? So just make sure you just have to tell them all your symptoms. Write it down in your phone. If you have any questions, take it with you. And if you feel like when you take it there, you're being ignored, and you're not getting better, find somebody else. You
There
always
you
want to
go.
make sure that you're your own advocate and you see doctors or medical providers until you get to somebody that's going to listen to you and explain things in a way that you understand it.
There you go. And I always say nobody knows you better than you. So
Absolutely.
if something's not normal, talk to somebody that can help you, no matter who you are.
Mhm.
But
Absolutely.
again, I know you got to get back to work. Thank you so much for fitting this in your schedule today, Dr. Rasheeda Hall, all the way down there in Hattiesburg. But in honor of homecoming, Southern Miss.
To the top.
Talk to you soon, buddy.
All right, thanks.